Oh, that was so much less epic than I was wanting it to be. I apologize. I wanted like all those to crack. So moving into the muscles, and the muscles that are going to move really the head and the spinal column and the vertebral column. There's some muscles that are going to be kind of moving and manipulating the ribs for expiration and inspiration, but for the most part, we're going to be focused on the other primary joints associated with the axial skeleton. When we're talking about muscles that are going to be moving the head, we can realistically, just like most other joints, right, we can separate into anterior and posterior compartments. On the anterior side, this is going to be almost exclusively flexion. And there's a ton of muscles here, and I don't want you guys to pay attention because you really, it's not that I don't want you guys to pay attention to these muscles, but you can't palpate these. They're really hard to tell the difference. What I want you guys to know is that there's two really main classes of anterior compartment muscles that are going to be really manipulating the head. And we're going to have suprahyoid muscles. So we're going to have muscles that are they're originating and inserting above the hyoid bone. And then we're going to have infrahyoid muscles that are going to be originating and inserting lower than the hyoid bone. And the difference is going to be on how much movement they're going to be producing and whether or not they're producing cervical spine flexion or if they're producing like head flexion and extension, or if they're manipulating and rotating the atlantoaxial joint or if they're atlanto-occipital joint. Just like we had with the anterior compartment, we're going to have a series of posterior compartment muscles. Again, it is a ton of muscles here. I'm not going to ask you guys to know these specifically. But what I want you to know is that the posterior muscles that are going to be moving the head and neck are going to be responsible for extension and that lateral rotation, so that right lateral rotation and that left lateral rotation. Now, what I do want you guys to know is the sternocleidomastoid. We've talked about it already. We've gone over origin, insertion, some. It's shown up a little bit already. What the sternocleidomastoid is going to be responsible for is extension of the head at the atlanto-occipital joint and flexion of the neck, right? So it doesn't really make sense, but let's think about why this is the case. So if we were to pull on this muscle, so the origin is on the manubrium of the sternum and the medial clavicle, and we insert on the mastoid process, so right here. As we pull, we're actually going to extend the head. So we will have extension of the head at the atlanto-occipital joint. So we will take and rotate the head upwards. But as we contract that muscle, we're also going to be pulling the cervical spine forward because we're basically spanning this distance, this horizontal distance from here to here. So as we're pulling that cervical spine forward, it's going to be flexion of the neck. Because the origin and the insertion have a lateral distance that they're going to be covering, there's also going to be some level of rotation, both left and right, occurring. So we're going to have two different sets of splenius muscles. We're going to have the splenius cervicus and splenius capitis. Both, regardless of them, they're both going to be responsible for extension. So it can be extension of the head or extension of the neck. With the splenius capitis, it's actually going to have an origin on the spinous processes of the cervical spine in the upper 3 or 4 thoracic spine, and it's actually going to insert on the mastoid process, on the posterior side of the mastoid process on the occipital bone. So we're actually going to be pulling that head back in extension. On the other side of things, for the splenius cervicus, we're going to be originating lower down on the thoracic vertebrae, but then we're going to be inserting up on the transverse process of the first 3 cervical vertebrae. So we're actually going to be coming up and wrapping around onto the transverse, onto those side processes. And what that's going to allow for is rotation to occur, but it's also going to allow for that neck extension to occur. You can't really tell because I'm sitting here in frontal view for you guys, but you're also going to be extending that neck all the way back. As we're working our way down the vertebral column, we're going to have 2 different groups of muscles on the posterior side of things that are going to be interspinal as well as intertransverse. What the interspinal muscles are going to do is they're going to actually connect spinous process to spinous process, spinous process to spinous process, spinous process to spinous process, right? Interspinal. and they're going to be responsible for extension of the vertebra. You're going to have intertransverse groups of muscles that are going to run from transverse process to transverse process, transverse process to transverse process. And those are going to be responsible for some of that lateral flexion of the spine that's going to be allowed to occur, right? So that lateral flexion to the right, lateral flexion to the left. Continuing on the back side or the posterior side of the muscles of the thorax and the vertebra, we're going to be needing to talk about the serratus posterior. Just like we had a serratus anterior, we're going to have serratus posterior. They're going to originate on the spine, right? So they're actually going to originate in the spinous process of the vertebra, and they're going to insert on the ribs. Their primary function is going to actually be to help expand the ribs and help aid in the act of breathing and ventilation. We're going to have a superior portion and an inferior portion that are both going to be responsible for kind of pulling open those ribs and helping to expand the rib cage. We're also going to have a semispinalis thoracus muscles. Or what the semispinalis thoracus is a group of smaller muscles that originate on the transverse process of the thoracic spine and actually travel up and insert on the spinous process of the cervical spine. And what their primary goal is going to be is to basically traverse the distance from different spinal groups, right? So cervical, thoracic, and lumbar, and really kind of help to control and make the movement a little bit more homogeneous within the group. So it's going to help control some of that cervical movement and thoracic movement that would occur. Some of the most important muscles are going to be associated with breathing. Since we're talking about the thorax, since we're talking about the axial skeleton, one of the primary things that we're going to be controlling is breathing. When we think about what the lungs do and how the lungs work, they're going to be needing to expand and contract. They're going to be needing to change partial pressures. We're going to be needing to fill and contract or fill and expel the amount of air inside of our chest wall. And how we're going to do that is by actually manipulating the ribs and taking and lifting and compressing on those ribs, or expanding and compressing on those ribs to change the volume of air that is present inside of the chest cavity. One of the first muscles that's going to actually be doing that is going to be the diaphragm. It's going to really sit up against and inside, right along the bottom of the ribs to help control lung volume. So as it contracts, it'll actually take and flatten down and pop down, and that will increase the lung volume, allowing for air to rush in. Whenever it relaxes, or whenever we contract, whenever we relax it, we can forcefully relax it or not, it will actually return back to its normal place, and it will change the volume of air that's present in the lungs and force for an expiration. So the diaphragm is one of the most important muscles associated with the thorax. We're also going to have scalene muscles. So the scalene muscles are going to be responsible for increasing thoracic volume. They're going to be responsible for pulling up on the ribs, really elevating the first two ribs. So as you look over here, what you're going to see is we're going to be really dividing into muscles of inspiration and muscles of expiration, or muscles of inhaling and muscles of exhaling. I don't know why it got cut off over here. I apologize. We're going to have on the muscles of inspiration, the sternocleidomastoid, right? So we're going to be lifting up. The scalenes are going to be responsible for lifting those first two ribs. Our external intercostals are going to be responsible for really pulling up and out on those ribs. It's just like the serratus posterior would be. If we move to the other side of things and we start looking at the internal intercostals, our internal intercostals and our transverse thoracus are going to be responsible for contracting down and really squeezing down on the chest and forcing expiration. So where the scalene and the external intercostals and the serratus posterior are responsible for expanding and opening up the chest, the internal intercostals, and we'll get into some of the abdominis, are going to be responsible for really forcing down that lung volume and forcing expiration. Our erector spinae are some of our really cool muscles. Basically what erector spinae are going to do is they're going to span all the way down. They're going to expand from our head all the way down to our pelvis. And what their primary job is simply to keep us erect. It's to keep us standing up. So it will be a level of extension that will be occurring in order to force the spine to stay in that natural 3 curvature position. So it will help to maintain that upright posture. There is some lateral flexion and rotation of the spine that's going to be allowed, but for the most part, it's going to be that extension of the spine. Our Quadratus Lumborum is going to have an origin on the posterior top of the iliac crest, and it's going to actually insert on the transverse process of the lumbar vertebrae, and then also on the lower border of that very bottom false rib. And if we contract and bring the insertion towards the origin, what you're going to see is that we'll be responsible for some lateral flexion to occur, right? So we'll have to be pulling our spine towards our pelvis in some level. A really main function of the Quadratus Lumborum is going to be providing stabilization to the pelvis. So it's going to actually help to stabilize and maintain that pelvic position. It can contribute to some anterior pelvic rotation and lateral pelvic rotation, but for the most part, it's going to be that lateral flexion and stabilization of the pelvis. Our abdominal muscles are going to be really divided into a couple different groups. So we're going to have Erector Abdominis, which is that sheet-like muscle that's going to be sitting across the front, which everyone's the most familiar with. We're going to have external oblique abdominals, internal oblique abdominals, and we're also going to have the transverse abdominis. So the rectus abdominis is, again, it's like the sheet-like muscle. It's actually going to originate on the crest of the pubis, and it's going to insert on the ribs in the xiphoid process. So it's going to insert all the way up at the bottom of the sternum, basically, and on the ribs. That means that if we're actually pulling from the sternum towards the pelvis, we're actually going to be inducing a level of flexion here. So we're going to be helping to pull the chest towards the pelvis, or like you would get with a crunch. Our external oblique muscles are going to originate on the borders of the ribs, so on the lower 8 ribs on the outside of the ribs, and it's going to actually insert on the anterior crest of the iliac, so the anterior iliac crest. Since we're going to be moving from insertion towards origin, we're going to be pulling that pelvis up towards the ribs, or we're going to be going through a lumbar flexion or a lateral lumbar flexion from right to left. So we will be pulling forward. As you can look here, you can see that the muscle fibers are actually running forward. We will be pulling forward for lumbar flexion, but we'll also be pulling to the side and pulling the pelvis closer to the ribs laterally as well. So we'll have lateral flexion as well as regular lumbar flexion. Or internal obliques are going to have an origin on the anterior side of the iliac crest, and they're going to insert on the lower 8th, 9th, and 10th ribs. And they're also going to insert on the linea alba, so right down that center line of the rectus abdominis. Some of that, because of this position, because we're pulling from top to bottom, we're going to be pulling the ribs closer to the pelvis. But we're also going to be responsible for pulling the pelvis into a posterior rotation. So we're actually going to be posteriorly rotating the pelvis with this, as well as some lateral flexion to the right and to the left side. Now our transverse abdominis is going to have an origin on that iliac crest, as well as the lateral third of the inguinal ligament, so all the way down to the bottom. And then we're also going to have origin on the inner surface of the ribs. But then we're going to insert onto the crest of the pubis all the way down here at the bottom, and then we're also going to insert on the linea alba, that center line that runs down the rectus abdominis. And what that's going to do is it's going to allow us to essentially change the volume of gas inside of the body. So the transverse abdominis is really going to be responsible for serving as our internal weight belt, if you will, right? So it's going to be providing a support structure for us, but it's also going to be able to force expiration by contracting and really changing volumes inside of the body. So that's it. There's not that much nuanced stuff that's going into the axial skeleton as compared to some of the appendicular stuff. But you guys know that I'm always here. If you have questions, reach out to me. Until next time.